You're coming out of the plenary session. What are your takeaway messages?
So we have a very good program, and the plenary session was elaborating on novel approaches in non-surgical periodontal therapy and in surgical approaches. So the main information and the main conclusions were related to the use of the combination of natrium hypochlorite and hyaluronic acid, the crossing formulation, in conjunction with non-surgical treatment in order to improve the outcomes. And the indication could be during the hygienic phase, the step 2 treatment, but also in the maintenance phase. In terms of surgery, we defined some indications for the use of hyaluronic acid. For intrabony defects, 3-wall defects and contained type defects can be treated with a material alone. However, if you are facing larger defects, we like to combine with either a collagen scaffold or maybe a bone graft, bone substitute, in most cases without a membrane. And one important aspect that we elaborated on is also the bone augmentation. That means if you have larger areas that are treated with dental implants, we need bone. And in these cases, the combination of the graft material with hyaluronic acid may, first of all, have a practical advantage because it creates the so-called sticky bone, but also due to the activity of the hyaluronic acid, we have, in fact, a faster healing of the soft tissues, which will, of course, affect also the healing of the hard tissues, because if you have a faster closure of the wound, you may have a better environment for the bone to regenerate. And I think that these main messages were very nicely conveyed to the audience. And in fact, the messages show that we have something in our hand that can be applied already on Monday in the clinical practice.